Guys, what's going on? This is Dr. Chadkins, and this is just an awesome case study, awesome patient, and awesome timing based off the fact that we just talked about in my last video the importance of primary care, having a good relationship with someone, and tracking your health more than just musculoskeletal. And even though musculoskeletally it can be incredibly complex, how am I moving? What's the relationship I have with my muscles in terms of what their strength and the range of motion is and what I'm doing every day? That's a very deep one door that we have to go through, but we also have to be cognizant of all these other doors of health. So this is a client of mine who has a really cool take on his health where he wants to track data and kind of see trends. So we brought this to our attention today. Now you can see that this is more of a cardiovascular component of it. We've got also our lipid levels, we've got HDL levels and calcium levels and all this really cool stuff. And if you have a good relationship with a primary care physician, you can do something like this. You can track it, you can present it, and you can be attentive to something like this. And to be honest with you, I think in a perfect world, we would all kind of do something like this. So I really got to credit to him because he's being proactive, he's being preventative, and honestly, that's less than 1 out of a million of typical Americans that I treat with, honestly. So I wanted to point out one thing, and this is kind of what we had talked about today. He's even got normals over here, so a normal of a calcium score more than 400 is bad, and you can see here that he's tracked. As of most recently, he's had elevated calcium scores, whereas about 5-6 years ago, it was closer to the norm, but still a little bit high. Now you can see that it's nearly doubled. His calcium score has nearly doubled. So today we got in the conversation of, well, what causes that? What do we need to do to help out to improve that? Now I know for me it's slightly outside the wheelhouse, but what we did start to do is just start to talk diet, start to talk about what relationships he has to who, so that he can get the information he needed. So guess what? You bet that I referred him to whoever that I felt like could best help him get the information he needs to address this. And that's predominantly what we spent time on today. We also spent time talking about how he's taking a statin. I know quite a few of us take statins too. Starting to develop a little bit of shoulder pain. And he's kind of curious. He's ahead of the game because he's working with a trainer who is thoughtful about this. To what extent it's called statin-induced myalgia, where if you increase the level of statin, you can actually start to develop some muscle pains. So that we have to weigh out that versus a differential diagnosis of maybe a tendonitis or an impingement. And because of his calcium, we even discussed the topic of hyperparathyroidism, where you have increased calcium, and calcium can land on certain muscles, like in this case, the rotator cuff, the supraspinatus, to what extent that is causing his pain. And that's kind of what we talked about today. So I know we kind of jumped around, but I just thought that this was really cool timing in terms of someone is tracking his information, and we're using that to provide him with the information that he needs at this point in time so he can find the person to help guide him to what he needs for his health. And at this point, he needed my help to not only assess musculoskeletally, but also from a cardiovascular perspective. All right, guys, thank you so much, and hopefully that was helpful.